And good afternoon, everyone. We appreciate this opportunity to update you on where we stand with COVID-19. Today, we report an additional 409 Tulsa County residents who have tested positive for COVID-19, which brings us to a cumulative total of 51,319 people who have tested positive since the response started. The good news is that 45,751 of those individuals have recovered. There are currently 5,139 confirmed active cases of COVID-19 in Tulsa County. In 2020, there were 411 Tulsa County residents who died from COVID-19. 18 more deaths have been reported so far this year, bringing the total to 429 Tulsa County lives lost to COVID since the start of the pandemic. They leave behind grieving families, friends, co-workers, and loved ones who mourn their passing to this virus that unfortunately has taken so many from us. Throughout my career in public health, I've had the honor of serving alongside countless public health servants. No one better exemplified a public health professional with a heart for service than THC Division Chief of Adolescent and Child Health, Pam Rask, who we lost to the virus on December 26th. In the same way I would grieve the loss of a family member, I am grieving the loss of a team member. The entire Tulsa Health Department family is mourning the loss of Pam, who spent her 35-year career in public health at THD. Her leadership, her big-spirited laugh, her passion for helping others, and her legacy will live on in the countless lives she touched through the development of community health programs to serve Tulsa County residents. She was a mentor not only to staff within THD, but in the community. To everyone who lost someone this year, I'm sorry. I'm so sorry for your loss. To everyone who has been impacted by this pandemic, and I'm truly speaking to everyone, I'm sorry for your loss too, as it feels as though this virus has taken so much from so many people this year. I'm sure you've all heard that there's a new variant of virus circulating now. And despite the pandemic and the many ways that it's divided us, I think we can all agree that 2020 was one of our worst years ever. 2021 brings good news of a vaccine that's proven effective against the virus, but it will take months before we reach sufficient herd immunity in our community for life to return to any semblance of our pre-COVID life or any feeling of normal. Tulsa County, and I cannot state this more urgently, we must remain vigilant. Scientists have identified at least two new concerning strains of the virus, the UK variant and the South African variant. The UK variant was first confirmed in the United States, specifically in Colorado last month. I am not aware of any detection in Tulsa County at this point in time. However, it is likely that there are more undetected cases within the United States, and it's not unreasonable to assume that it will reach Tulsa County at some point. We are early in our efforts to understand this new variant and are sharing what we know at this time. What we know is based on the evidence we now have and may change as new data emerges. Based on the analysis of the variant's genome and tracking of cases associated with it, the variant may be spread more easily and more quickly than previous strains, which could result in an increased overall spread. This variant does not appear to cause more severe disease or death than the previous circulating strains. However, a higher rate of transmission could lead to more cases, which would increase the number of people overall who need clinical care. This would further strain our local healthcare systems. We continue to emphasize the importance of wearing a mask, staying at least 6 feet apart from others, avoiding crowds, ventilating indoor spaces, and washing hands frequently. These are our best tools for preventing the spread of the virus, no matter the strain. The science is clear. Mask works, social distancing works, hand washing works, the vaccine works collectively, and it's going to take all of these collectively. These tools are going to help us end the pandemic. I'd like to give you an overview of Tulsa County data. By Christmas Day, more than 7% of the entire population of Tulsa County had tested positive for COVID-19. We are likely to surpass 8% of the population testing positive by tomorrow or Friday, which is unfortunately earlier than anticipated. Just a week ago, we expected to reach 8% of the population on January 10th, but now the trends are increasing and the date has been moved up. Our current 7-day rolling average is 531.1, meaning that on average, 535 people are diagnosed with COVID-19 every single day. In December, the 18 to 35 age group continues to be the age group with the most cases, again followed by 36 to 49-year-old age group. This is represented by 18 to 35 being 30.07% of all of our cases in December, and our 36 to 49-year-old age group being almost 22% of all of our cases. December was the month with our most cases of all time during the pandemic, with 14,261 cases in the month of December alone. November was our second worst month with 11,121 cases. COVID-19 is now the third leading cause of death within Tulsa County, surpassed only by heart disease and cancer. Over 3,400 Tulsa County residents with COVID-19 have been admitted to the hospitals. During the month of December, we collected 3,391 samples at our THC testing sites. In December, the positivity rate for THC testing sites was 29%. Last week alone, our percent positivity rate was 38.43%. In November, the percent positivity rate for November was 29.8%. Again, that's just testing done by Tulsa Health Department at our pods only. I'm sure everyone is eagerly awaiting information about the vaccine, and I'm going to share with you what we know at this time. Just as an overview, the supply in Tulsa County is dependent on the federal allocation from Operation Warp Speed to the state of Oklahoma. The state then makes allocations to each county. Tulsa County received an initial shipment of Pfizer vaccine on December 14th and began administering the very next day to phase 1 priority groups in partnership with our local healthcare systems. After the Moderna vaccine received emergency authorization from the FDA, Tulsa County received shipments of Moderna vaccine as well. Tulsa County continues to work to complete phase 1 while transitioning to select priority groups within phase 2, including outpatient healthcare workers and first responders. THC has administered 3,274 vaccines to date. There have been 12,161 doses administered in Tulsa County to date. And that's a number within the Oklahoma State immunization system at this time. Due to delays with data entry, we believe this number to be lower than the actual doses administered by a couple of thousand. There have been 23,175 vaccines allocated to Tulsa County at this time, and each vaccine has either been administered, is scheduled to be administered to someone with an appointment, or is allocated for a specific group, such as a long-term care facility. We have been operating a drive-through vaccination site to administer the dose safely and effectively while ensuring social distancing. The challenge with administering this vaccine is that it's not like a flu shot where you can get it and go. There's a 15 to 30-minute observation period required after the vaccine is administered. And as a reminder, appointments are required to receive the vaccine. Just last night, we learned we will be receiving an additional 5,625 vaccines for Tulsa County to use next week. They will be sent to THD, and we will then use some of these doses for our operations and deliver the rest to our healthcare system partners. Now, here's the part I know that most people are anxious to hear. Tulsa County residents who are 65 and older will be able to sign up for an appointment beginning tomorrow using the Oklahoma Vaccine Portal. A link to the portal can be found on our website. The vaccine portal allows any Oklahoman to register their information to receive notifications when they're eligible to receive an appointment to receive vaccine. You can sign up right now to receive the notifications. I myself signed up just about an hour ago and look forward to receiving the notification for when I can schedule my appointment. The appointments for those 65 and over will begin on Monday, January 11th. There will be about 200 available appointments per day for people receiving their first dose. Make sure you register in the Oklahoma Vaccine Portal so you can schedule your appointment when the system opens up. We will also be administering the second dose to about 400 people per day next week as well. The appointments will go very quickly. And we do recognize that this is not an equitable system at this time. If you're watching this now and have a loved one who you know will struggle with an online sign up, please reach out to them and offer to help get them signed up. Residents can also call 211 for assistance with signing up, but please be advised that high call volumes may make that very challenging for both 211 and the person calling in. These appointments are for individuals who live and work in Tulsa County who are 65 and over. It doesn't matter if you have an underlying health condition or not. All you need to bring is an ID to verify your age. We will also expand additional appointments for healthcare workers and first responders who have not yet been vaccinated. That information will also be on our website. Additionally, we are working with the Oklahoma Caring Band to arrange for mobile vaccine clinics specifically for Tulsa County teachers who are 65 and older. We will be working with our local school districts to provide information regarding how to access these mobile sites when the details are ironed out and the schedule is set. There are more than 1,000 pandemic providers in the state of Oklahoma who have signed up and have been approved to receive and administer the vaccine once the supply becomes more readily available. Just as it was in the early days of COVID-19, when we were doing testing, there was limited supplies and limited access points. The same is true at this point for the vaccine. Eventually, there will be many providers in our community who have the vaccine and who will be able to administer it. We ask for patience as we work through each of these priority groups within each phase of the state's plan. The team at Tulsa Health Department, our Oklahoma Medical Reserve Corps volunteers, our healthcare system partners, and our National Guard members who are assisting with the response are working tirelessly to provide immunizations to operate COVID-19 testing sites, conduct disease investigations and contact tracing, and operate a phone bank for questions from the public. I couldn't be prouder of this team and their 24/7 efforts to keep Tulsa County residents safe. We may close our physical building at 5 p.m., but I can assure you that many members of our staff are working late hours or from home in the evenings and weekends to take care of our community. For our staff's mental health to continue this marathon response, they also deserve time to find healthy outlets from the stress of working a public health emergency for over 10 months. There are also parents and caregivers who are trying to navigate this through at their home as well. I understand that I've just given you a lot of information. The best place to go for information on COVID-19 vaccine in Tulsa County is our website. Please go to www.tulsa-health.org/COVID vaccine to follow the latest and all the information that you need. Follow us on Facebook and Twitter for updates. You can also call us at 918-582-9355 during regular business hours or call 211 anytime. We will continue to provide information on when vaccine will be available to you and when it's your turn to receive vaccine. And I'll close with this. We have not yet seen the impact of the Christmas and New Year's holidays. I want to thank everyone who changed their plans and formed new traditions this year to celebrate safely. For anyone who gathered with anyone outside of your household, it's important to continue to monitor yourself for symptoms and seek testing if you need it. THD continues to operate COVID-19 testing by appointment only. You can schedule a test on our website. There's no cost and you do not need symptoms to be tested. Please continue to follow public health guidance if you test positive. Immediately notify anyone you had close contact with during your infectious period. High volumes of new cases reported daily make it very difficult for the health department to follow up on every single individual. Please stay home when possible. Attend religious services virtually. Use curbside and delivery methods to obtain food and medical supplies. Wear your mask when around anyone who does not live in your house. Wash your hands. Try to enjoy some time outdoors in the fresh air. Make healthy eating choices and continue your routine medical appointments and care. Collectively and together, one Tulsa, we will get through this. At this time, I'd like to introduce Mayor Bynum.
Thank you, Dr. Dart. Please stand by. Mayor Bynum. Mayor Bynum, your microphone is muted. Okay, we are having trouble hearing you. We can see you, but we cannot hear you. Should I go to Karen? Looks like we're having some technical difficulties right now. We're going to go ahead and move on right now to Commissioner Karen Keith. Please stand by.
To ratify the electoral votes.
Karen Keith, you're up, please.
Okay.
Subjected to now the House and Senate are currently debating
You're up now, Karen. Go ahead.
Hi, Mayor, we'll get to you in just a second. We get those audio issues fixed. So from Tulsa County and from me, I want to say that 2020 is behind us, and I think we're all looking to a brighter 2021. But to get there, we are all going to have a lot of work ahead of us. And I know that many of us have struggled this past year with the impacts this pandemic has inflicted, but I remain hopeful and know we will get to a better place where we're all healthier, happier, and safer. And with that in mind, please remain vigilant and continue the 3 W's so we can slow the spread of this virus as vaccines are administered. As you just heard from Bruce Dart, we are going to see another surge based on the holidays. So we just absolutely have to stay vigilant. And this will not be a quick process getting these vaccinations of youth. It may take 6 weeks to just do the 65 and up. So your patience and your diligence are really important. And I want to take a moment to personally thank our frontline essential workers, Dr. Dart, his team, Mayor Bynum, Joe Krylacek, our Director of Emergency Management, and the Tulsa County CARES Committee led by Commissioner Peters. Their work and leadership continues to be critical as we ramp up these vaccinations. At the end of December, the deadline for spending CARES Act dollars was extended 1 year to the end of January 2021. We are thrilled with this longer time frame that will allow completion of projects and programs that are currently in the works. However, the bill that provided the extension did not include any new direct aid to state or local governments. And at this time, we are not accepting any new applications, but the BOCC will continue to monitor and work with the previously funded applicants. We remain optimistic that future federal programs will extend additional dollars to local governments. Now, shifting slightly, I'd like to briefly talk about the upcoming Chili Bowl. As many of you know, this iconic Tulsa event will officially start at Expo Square this coming Monday. And while I know you might be opposed to having this event during a pandemic, I want to make it clear to everyone listening and watching that Expo Square takes its COVID protocol seriously. The events at Expo Square, like the Chili Bowl, are helping to keep Tulsa's economy alive and provide a lifeline to the local small businesses that surround it. Attendees at the Chili Bowl will be 25% of capacity. That's 25% of who normally goes in for this event. And strict COVID protocols will be followed at all the events. Emmett Hahn, the creator of this event, has been committed to having the Chili Bowl safely because he knows the economic impact that it provides to the Tulsa area. Lastly, I want to remind everyone of some changes taking place at the courthouse. Tulsa County District Court made adjustments to court operations last month, including canceling all jury trials until February 1st. However, all proceedings at the Family Center for Juvenile Justice continue as scheduled, which unfortunately includes the eviction dockets that were moved to this location in June for better social distancing. That's a little editorial comment. Full details on the changes can be found at tulsacountydistrictcourt.org. And while the majority of court-related activities are postponed, the courthouse remains open with access to the treasurer, assessor, court clerk, BOCC, and other departments. That said, we are starting the process of moving to our new HQ building. It's located just kitty corner from the courthouse. We'll be doing that over the next 8 weeks. So all areas of county administrative functions will be relocating. And by the end of February, the courthouse will be home to most of the court-related operations and services. This means that over time, the public defender's office will finally be back at the courthouse, a much needed change to make it easier for our most challenged citizens to gain equal access to the courts. Our new county headquarters building will be at 218 West 6th Street. We are thrilled to be moving into a building that will allow our core services to be housed in a central location. And of course, it means I'm going to have to clean out this office, and you can tell it's messy after 12 years of collected clutter. So until the vaccines have created herd immunity, we continue to ask that you conduct your county business over the phone, by email, or physical mail as much as possible to protect yourself and our employees. A full list of contacts for every office and elected official can be found at tulsacounty.org. Stay safe, get in line for your vaccine, and I hope to see all of you soon. Mayor Bynum?
Thank you, Commissioner Keith. Stand by, and we're going to try to bring Mayor Bynum back in. Thank you. Mayor Bynum, thank you. No, sir, I can see you, but I cannot hear you.
Are you using an external microphone?
Thank you, sir. We're still having technical difficulties, but we will make sure and provide Mayor Bynum's remarks following the news conference due to these difficulties. We will now move to questions, so please stand by.
Also, went through some statistics that we had reached 7% of positive in the complete population. On December 25th, we expect to reach 8% this week. That's
Thank you. We will now move into the question and answer.
cases of Tulsa County in December. That's the highest month since the pandemic.
First question is from Fox 23 from Rick Marinon for Dr. Dart. When you say 7% of the population in Tulsa County tests positive on Christmas, does that include current and previous cases at that time, or is that 7% of Tulsa County's population that had COVID on Christmas Day?
That's our cumulative total of positive results throughout the pandemic.
Thank you, Dr. Dart. Another question from Fox 23's Rick Marinon for Dr. Dart. On Monday, the state health department said that a primary caregiver to someone 65 and up can also get the vaccine with someone who is 65 and older that they live with. How does a primary caregiver make an appointment for them and their loved one at the same time? Do we need to make two separate appointments back to back, or will one appointment shot work for someone who is 65 and older and their caregiver?
So right now, our groups only include those 65 and older and not their caregiver. And if you go on I have been on the state's vaccine sign up sheet, and it's very specific. It gives you categories when you sign up, and it tells you if you fall into that. So, and so at this juncture, we're only testing people who are within that group and not their caregivers as well. Ellen, is there anything? Did I miss anything? And then you want to add to that, Ellen?
No, you're fine. The only thing I would like to add is if there are two individuals who do fit the priority group who are scheduling appointments, they would need to schedule two appointments, not two people showing up for one appointment. Again, all of that vaccine is allocated. Thank you.
Thank you, Dr. Dart and Ellen. Next question is from Fox 23's Rick Marinon for Commissioner Keith. Are you aware of any new funding that's coming to Tulsa County from the most recent COVID relief bill passed around Christmas?
So not to Tulsa County. I do think there are going to be some funds that can be used for housing and some of those issues, but not directly to Tulsa County, no.
Thank you very much, Commissioner Keith. We have Mayor Bynum here with us now, so I want to see if he would like to make some comments. Mayor Bynum?
You hear me this time?
We have you, Mayor.
Hey, all right. Third time's the charm. Okay. Sorry about that. My computer's been working fine all morning, but I'm on my iPhone now. That works apparently. First, I want to say, especially after listening to Dr. Dart's remarks, how thankful I am to have somebody who actually knows what they're talking about leading this process in Tulsa. Thank you, Dr. Dart, to you and your team for all your work over the course of the last year and for helping guide our community through this moving forward as we enter this next phase of this pandemic with vaccine being deployed. I also want to say that all of us in Tulsa are mourning the loss, as Dr. Dart mentioned, of Tulsa Health Department leader Pam Rask, but also of IMSA paramedic Debbie Rusher, both of whom died over the holidays from COVID-19. Both Pam and Debbie spent decades in this community working to save lives, and our thoughts are with their families, their friends, and their coworkers in this very hard time. As we start the new year, I think it's important that we also reflect the reality that over 400 of our fellow Tulsa County residents have died because of this virus that most of us weren't even thinking about at this point a year ago. I'm very grateful that we have a light at the end of the tunnel with deployment of the vaccine now underway in Tulsa. And I've been getting a lot of questions about vaccine deployment. So I want to focus on just a few things on that for today. First, I want to emphasize that unlike a lot of the response that we've had here in Tulsa, the city of Tulsa has no role in the vaccine deployment. The federal government provides vaccine allocations to the state of Oklahoma. The state then in turn provides those to the Tulsa Health Department, and the Tulsa Health Department deploys them. But I've spent a lot of time learning about this process, and I just want to share what I know and what I'm telling my family and my friends. Every Tuesday, the state of Oklahoma finds out from the federal government what allocation our state will receive for the coming week. And then by Wednesday of that given week, the state then notifies the Tulsa Health Department what Tulsa County's allocation will be for the coming week. Only then, on that Wednesday, can the Tulsa Health Department start to schedule vaccinations for the week ahead. And by the way, those weekly allocations are being completely exhausted every single week. And this process, I know, it makes it very hard for the team at the Tulsa Health Department to plan and for people who want to get the vaccine to be able to schedule out in advance. But it's the process that we're getting from the federal government based on their allocations to the state of Oklahoma. And so that's the process that we will work with unless it changes. As Dr. Dart mentioned, tomorrow, the Tulsa Health Department will start scheduling vaccinations for people over the age of 65 in Tulsa County starting next week. And if you're over 65, you qualify. You don't have to have any other risk factors to go ahead and start scheduling those vaccinations. We expect, at least this is what I've been told, that process for vaccinating everyone in Tulsa County who's age 65 or over, we think that'll probably take 6 to 8 weeks to carry that out in its entirety. I've had a lot of people ask me about driving to other counties to get vaccinations there, and in particular, if this is cheating the system. The policy of the state of Oklahoma is that vaccinations coming to Oklahoma belong to all Oklahomans equally. The distribution to different vaccination sites around the state is for geographical convenience, and it doesn't limit the administration of that vaccine to people living in the county where the site's located. So if you can get an appointment in a different county earlier than you think you can get it in Tulsa County, please know that you're doing so in full compliance with the state's policies. It is not cheating. What I would ask as we transition from a phase of vaccine deployment that was largely focused on administration of the vaccine inside of our local health systems and governmental agencies, and moving now into a more public phase of this process, is this. Let's handle this process the way Tulsans should, in a calm, cool, and collected way. Everyone who wants a vaccine is going to get one, but we all have to wait our turn in the process. And I have complete confidence that the Tulsa Health Department is going to deploy this vaccine just as quickly as they can get it. But again, they are relying on what they get from the state, and the state is relying on what they get from the feds. Administration of this vaccine is going to slowly but surely bring this pandemic to an end. And I'm eager to receive it myself when it's my turn to get it. I want to thank the workers who have been administering the vaccine throughout phase one to healthcare professionals and first responders. I know how hard you are working, and I hope you know how much it is appreciated. And speaking of hard work, I want to again, and we can never do this enough, I want to thank every healthcare professional working to provide care to patients in hospitals throughout this region. Our hospitals in Tulsa have never been under a heavier burden at any point of this pandemic than they are today. Our COVID hospitalizations nearly doubled in the month of November, and they have remained at record levels ever since. I also want to thank every Tulsan who is showing your support for those healthcare workers and those professionals by wearing a mask in public. This will continue as vaccine is deployed to be a crucial tool for preventing the spread of this virus. And I'm grateful for everyone who's putting the health of your neighbors ahead of your own convenience by wearing a mask in public. I'll now turn it back to the Q&A portion of this briefing. Thank you.
Thank you, Mayor Bynum. Our next question is from Kevin Canfield, the Tulsa World, for Dr. Dart. You mentioned it would be months until a vaccine would be more widely available. Can you be more specific? 3 months, 6 months, 9 months, that kind of thing. Your microphone is muted,
So I
Dr.
got
Dart.
you. So no, we really can't because we don't, as the mayor just said, we don't know what vaccine we're getting until a week before we get it. And we do know that while there's been millions of doses promised, there has not been millions of doses manufactured yet to be distributed throughout our country. So If we could schedule 2, 3, 4 months out in advance, trust me, we would. If we could schedule 3 weeks out in advance, we would. But we have no way of knowing what our allocations are going to be more than a week ahead of time, so we can't.
Thank you, Dr. Dart. Next question is also from Kevin Campbell, the Tulsa World, for Dr. Dart. How are the hospital's bed capacity right now?
As the mayor said, they're full, and they're full as they've been throughout this entire pandemic. And God bless our healthcare workers. They've been doing an amazing job. But no one can sustain this kind of pressure. We've got to start making better decisions so that we're not putting ourselves at risk where we end up in a healthcare setting. So they're very full. And they're working extremely hard to keep people safe.
Thank you, Dr. Dart. Next question is from Russell Mills with KRMG. Can Dr. Dart discuss the underreporting of cases or fatalities? I'm hearing statistics nationally that indicate as many as 35% of cases go underreported.
And that could be a possibility because so many cases are asymptomatic, but ones that are being tested and testing positive through a laboratory confirmation process are being reported. So we do know that we have many asymptomatic cases. What those numbers are, we have no idea. But if people are testing positive, those results are being reported and are being counted.
This question is also for Dr. Dart from Russell Mills. Is it accurate to say that testing overall is down significantly, and can you discuss the impact of that issue if it does exist?
We saw some lag in testing, of course, over the holidays, which I think is to be expected. We continue to fill our appointments up at our testing sites, but I know overall, both statewide and nationally, we've seen a decrease in some testing. I expect that to ramp up now that we're past the holidays. Supplies are not an issue at this juncture, so it's just a matter of people wanting to be tested, but our pods continue to be full, and we continue to test anyone who needs a test.
Thank you, Dr. Dart. Next question is from Rick Marinon at Fox 23 for Mayor Bynum. Last week, the Friday furlough for some city employees expired. Has the city budget recovered to where another furlough is not needed?
The answer is no. The council and I budgeted for half a year of furloughs, and our non-sworn employees reduced their pay by 10% for that period of time. But our budget is staying within the parameters of the budget that the council and I adopted, which assumed a record level decrease in revenue. And so from that standpoint, we're staying within the budget, but in the budget that we put together for the coming year, we're going to have to find reductions in other areas to address this reduction in revenue. So for the rest of this fiscal year, as long as we stay on course of where we are through June, we should be fine. But we have a lot of work to do between now and when we adopt the budget in June of this year to reflect the reduction in revenue that we're seeing as a result of being in the midst of both a global pandemic and a national recession. And I do want to add that the goal for me, and I imagine for my colleagues on the council too, is that we want to make those reductions and not do it through another furloughing. I think furloughs are a necessary thing from an emergency standpoint, but they're not a good long-term budgetary option.
Thank you, Mayor. I have another question from Rick Marinon for Mayor Bynum, kind of a follow-up question. How close are we to layoff territory?
We aren't, thanks to a combination of two things. One, having non-sworn employees sacrifice their pay that enabled us to make no reduction in public safety staffing over the first half of this fiscal year. And that's in sharp contrast with what you would have seen a decade ago when we entered into the Great Recession and you were seeing police officers get laid off as crime was increasing. We are not in danger of that because we had non-sworn employees willing to sacrifice their pay. And then you had an administration and a city council that had spent the last 4 years building up our rainy day fund in good times to be able to weather out the bad times. But that is not a long-term sustainable way to go about it. You've got to adjust your budget. We're not like other governments where we get to borrow money or print our own currency. We have a balanced budget at the city of Tulsa every single year. We only spend what we bring in. And the job for us between now and the next fiscal year is to identify what reductions we need to make in light of the reductions in revenue that we're seeing.
Thank you, Mayor Bynum. That will conclude our press conference for today. Thank you all for joining us. Our next scheduled press conference is Thursday, January 21st at noon. So thank you all very much and have a wonderful day.